हाउ डज हाइमन ब्रेक्स? हाइमन कैसे ब्रेक होता है?
See, what is hymen? Hymen is a thin piece of membrane that partially covers the entrance of the vagina. So, since it's a flexible thing, it stretches and it is prone to tear. There are various reasons for tear of hymen, right? In case of penetrative vaginal sex, because of the stretching, the hymen might break. It might lead to a little bit of bleeding also in some people, but not always. The other reasons for hymenal break or tear can be hymen might get warmed down and thin out over a period of time because of like stretching and indulging in physical activities like biking, horse back riding, gymnastic. So even use of tampons can also stretch and break the hymen. So these are the most common reasons for a hymenal tear.
व्हाट इज हाइमेनोप्लास्टिक सर्जरी? हाइमेनोप्लास्टिक सर्जरी होती क्या है?
See, hymenoplasty surgery, it's a very simple thing. It's a reconstruction of your hymen. When your hymen tears, there are many multiple tags which are left behind. We reconstruct your hymen from those tears by using a suture which dissolves in 15 to 20 days.
इज हाइमेनोप्लास्टी सर्जरी इज पेनफुल? क्या हाइमेनोप्लास्टी सर्जरी एक पेनफुल प्रोसीजर है?
बिल्कुल नहीं. Hymenoplasty surgery, हम usually we do it under local anesthesia, and if any patient is asking for a little bit of relaxing medications, we give her a little bit of sedatives also. बिल्कुल painful नहीं है. It's a very comforting surgery in fact for the patient.
व्हाई अ वुमन डज हाइमेनोप्लास्टी सर्जरी? एक औरत हाइमेनोप्लास्टी सर्जरी करवाती क्यों है?
See, there are many reasons for a hymen reconstruction, right? But to name a few is, first of all, it's a religious taboo in certain religions. Like they consider hymen as a sign of virginity, and if she is not having this thing intact hymen, then she might have to face many social or even legal ramifications because of this. The other thing is might be in cases in which patient had a rape or a sexual assault in which a hymenoplasty helps her in getting back her confidence, and she feels very mentally peaceful also after doing this procedure. And the most common reason being after a penetrative vaginal sex or maybe because of any kind of injury to the hymen. So all this, considering all these things, patient might want to get her hymen repaired.
हाउ सेफ इज दिस सर्जरी? ये सर्जरी कितनी सेफ है?
See, ये सर्जरी मैं एक ही चीज ये सर्जरी के बारे में बोलूंगा. द रिस्क ऑफ दिस सर्जरी is the same what you have with the if you go for a dental procedure. It's completely safe. There is hardly any risk or complications. The only thing I'll suggest is get this procedure done from an expert who has an experience in doing this procedure.
इज हाइमेनोप्लास्टी सर्जरी इज परमानेंट? क्या हाइमेनोप्लास्टी सर्जरी परमानेंट प्रोसीजर है?
No, hymenoplasty surgery should not be considered as a permanent this thing, because if you engage in penetrative sex or some kind of physical activities, your hymen is bound to tear. So it's not a permanent thing.
डज हाइमेनोप्लास्टी अफेक्ट द पीरियड साइकिल? क्या हाइमेनोप्लास्टी सर्जरी हमारे पीरियड साइकिल को इफेक्ट करती है?
No, see, hymen आपके vaginal opening के बाहर रहता है. It's a very superficial this thing. So when we do your hymenoplasty surgery, हम आपके अंदर के organs या tissue किसी चीज को हम touch नहीं करते. So no, कोई भी difference नहीं गिरेगा.
एट व्हाट एज अ वुमन कैन डू हाइमेनोप्लास्टिक सर्जरी? कौन सी एज
Any
में वुमेन हाइमेनोप्लास्टिक सर्जरी करवा सकती है?
any female who is above 18 years of age can opt for a hymenoplasty.
हाउ लॉन्ग डज द प्रोसीजर टेक? एक प्रोसीजर करवाने में कितना समय लगता है?
So the procedure takes 30 minutes, but we keep you in recovery room for at least 4 hours after the procedure. So it's a kind of day care thing. आप मेरे पास मॉर्निंग में आ जाइए, 4 से 6 घंटे में आप घर जा सकते हो।
डू आई हैव टू स्टे इन द हॉस्पिटल आफ्टर द प्रोसीजर? क्या मुझे हॉस्पिटल में रहना पड़ेगा प्रोसीजर के बाद भी?
बिल्कुल नहीं, एक 4 आवर्स का ऑब्जर्वेशन रहता है, उसके बाद यू कैन गो होम।
What precautions are to be followed after the procedure? कौन से precautions हमें follow करने पड़ते हैं procedure के बाद?
See, we give you the list of post procedure precautions to be followed. The first thing is हम आपको एंटीबायोटिक, पेन किलर, एंटी इंफ्लेमेटरी मेडिकेशन देते हैं that you have to take as prescribed. That is one thing. Second thing, you are not supposed to take a shower for at least 2 days after the procedure. Third thing, we tell you how to clean your private area and perineal area. So it's very simple. Hardly any much precautions you need to follow. It's a very simple thing, and most of the patients are very this thing are able to follow all the instructions very easily without any issue.
What are the chances to get infection after the procedure? Procedure के बाद infection के कितने chances रहते हैं?
The chances of having or getting an infection is very rare. But sometimes, yes, since the it's a very area, it has a mucosal surface, you might get this thing infection, but it is very easily controlled with medications. So don't expect you to have any kind of serious or major infection after the procedure.
How does it affect mentally to the patient? ये एक patient को mentally कितना affect करता है?
See, after the procedure, most of them recover their self-confidence. They feel very confident in like expressing themselves if they have got a hymenoplasty done. So, among certain procedures like breast procedures, hymenoplasty, these are very rewarding procedures for the patients, and the patients are very satisfied with this procedure.
How does it affect the hormones? ये हमारे hormones को कैसे affect करता है?
फिर हम आपके कोई भी ऑर्गन या टिश्यू को टच नहीं कर रहे, सो इट डजंट हैव एनी इफेक्ट ऑन योर फ्यूचर प्रेगनेंसी और योर menstrual cycle, nothing of that sort.